The next item is an item of major importance, establishment of a new extended producer responsibility drug disposal program. This is item 20. I want to turn...
Before we do, Mr. President, I need to recuse myself on advice of County Council based on an inherited IRA stockholding. I think I've now looked to County Council. I've said everything I need to say, and I should just get out of here. Okay. Thank you very much.
Thank you, Mr. President. For the Political Reform Act and County Council direction, I'm recusing myself from this item due to an existing conflict with Bristol Myers and others.
And, Mr. President, for the record, I also own drug stock and am recusing myself from involvement in this matter. Assistant County Counsel Danny Chu will sit in on this.
Thank you. Anybody else need to get up and leave? If so, we can just dispense with the entire item.
Shorten things.
I want to turn to Supervisor Yeager on this because it was his referral, I think back in 2003, that really launched this effort, and it's, as we'll hear, relatively complex issue at one level. But Supervisor Yeager, why don't you kick this off, and then we'll hear from County Council.
Great. And I assume you don't have any cards, speaker cards on this?
We do, and if you'd like to hear from them first.
Yeah, why don't we do that?
Great. So, excuse me, let me make the usual announcement that we are, of course, accepting public comment on all the items we hear today. We have several here on item 20. If there's anyone else who wishes to speak to item 20, if you haven't filled one of these white forms out yet over here, please do so now so the clerk can get it to me in time. The timer has been set for 2 minutes on public speaking all day. Not just on this item. And so I'm going to start calling people up 3 at a time to speak for up to 2 minutes. If you wish to speak for less time, of course, that's always welcome. Ingrid Velasquez, Paul Ledesma, and Carrie Hillis. You're all welcome to come up. And I'll call 3 more speakers shortly. Good afternoon.
Good afternoon. My name is Ingrid Velasquez. I work for the City of Cupertino Environmental Programs Division in Public Works. The City of Cupertino is a member of the California Product Stewardship Council and has been, or it's had its own City Council approved extended producer responsibility program since 2008. Today I'm here to voice the city's support for the county's ordinance, which establishes a new extended producer responsibility drug disposal program. The limited options for, residents to safely and conveniently dispose of unwanted medication creates both social and environmental issues. The proposed ordinance is the right solution because with county oversight, it will provide a producer-managed and funded system for consumers to dispose of unwanted drugs at local pharmacies and where most of these products are purchased. For these reasons, the City of Cupertino strongly supports NS-517.89. Thank you.
Thank you for being here, Ingrid. Paul Ledesma, followed by Carrie Hillis.
Good afternoon. My name is Paul Ledesma. I'm with the City of San Jose Environmental Services Department, where I'm a program manager in the Sustainability and Compliance Division. I'm also a board member of the California Product Stewardship Council. The City of San Jose expresses its support for legislation related to pharmaceutical product stewardship. The creation of safe, legal, and environmentally friendly means of disposal for all residents of the county, of which San Jose represents about half of the population, is a high priority. Without an appropriate pathway for disposal, these unused drugs will end up in our landfills and waterways. For this reason, the City of San Jose has long advocated for legislation to create product stewardship. The need for product stewardship related to pharmaceutical products is timely and essential for a safe and healthy Santa Clara County community. We commend the Board of Supervisors for taking this bold action today. Thank you very much.
Thank you for being here. It's much appreciated to hear from the City of San Jose. Carrie, welcome back up. And let me, bear with me just a second. Let me call the next 3 speakers. Karen North, Mark Bowers, and Andrea Ventura.
Carrie Hillis with the Santa Clara Valley Water District. The Water District's board has issued an official support position for this measure, and the reason for that is when improperly disposed of into the environment, pharmaceuticals are a form of hazardous waste that pose significant risks to vulnerable species in the San Francisco Bay estuary. Approval of this ordinance could result in a reduction of pharmaceutical compounds making their way into our local waterways and help the district to better achieve its mission to provide Silicon Valley safe, clean water for a healthy life, environment, and economy. And we've also submitted a letter of support from our board chair, which I sent to members of the board yesterday, and I can also provide that to the county clerk.
Thank you. And again, we appreciate the agency's support on the item. Yes, Karen, right?
My name is Karen North. I'm the Watershed Protection Manager with the City of Palo Alto. I'm also here representing the Bay Area Clean Water Agencies, which represents 43 wastewater treatment plants throughout the San Francisco Bay region. We've been working on the proper disposal of pharmaceutical waste for more than a decade. We actually worked with Supervisors Committee and on many bills early on when he was a senator on trying to make it easy for residents to dispose of. Our city council is constantly asking where they can easily dispose of medications. We are currently doing a piecemeal program, and we have collections at some pharmacies, but it's the taxpayers paying for it. And our program is not comprehensive enough to get medications out of people's houses and homes. And we literally people driving to our wastewater treatment plant every single day, multiple times a day, trying to drop off their medications. So this really is something that our community needs. And I have a fact sheet on our history and also our letter of support.
Well, I've asked the clerk to get that from you. Again, thank you to you and your agency for being here. Mark Bowers, I believe, representing the city of Sunnyvale.
President Cortese, Commissioners, thank you for this opportunity to comment. I'm Mark Bowers, Solid Waste Division Head for City of Sunnyvale. Mayor Jim Griffith was unable to be here and asked me to carry to you his appreciation for putting this item on the agenda and support for the ordinance. I have a letter from the mayor that I'll give the clerk of the board copies of. Echoing the preceding city representatives, I won't belabor those same points, but will offer you an analogy and ask you to visualize the solutions to unwanted pharmaceuticals as a stool. As we all know, it takes 3 legs to make a stool work and to be stable. And right now, this pharmaceutical waste stool has only 2 legs, and that's consumers and local government. So by passing this ordinance, we'll begin to add that critical 3rd leg to the stool by adding support from producers and manufacturers of these products. So City of Sunnyvale thanks you again and asks you to approve this ordinance.
Okay, thank you, City of Sunnyvale, for being represented here. Andrea Ventura and Christine Flowers, I think, are the last 2 speakers.
Good morning, or good afternoon, I should say. My name is Andrea Ventura. I am the Toxics Program Manager with Clean Water Action. And I'd first, to begin, like to submit a letter signed by 8 environmental and public health organizations that have approximately, well, I don't know the exact number, but tens of thousands of members here in the Bay Area, including the county. So I will submit that. This is not an abstract problem. We are finding pharmaceuticals in San Francisco Bay, including at levels that affect aquatic life. Any study that you read on the potential for human interactions is that we have a great unknown. The reality is that while levels are very low in drinking water sources, thank goodness at this point, that is expected to grow. And what we don't know is what the long-term effects of cumulative impacts of these chemicals are. The main thing I want to say, though, is that we, as I mentioned, have tens of thousands of members in the Bay Area. And one of the things we hear every day, and we talk to the public every day, we go door to door, that's how we inform public about water issues. What we hear from them every day is that they like this sort of model that brings in the industry that is profiting from the sale of products into the solution of dealing with the end of life of those products. And they feel that this is actually a shared responsibility model because they are already doing their share. They pay for pharmaceuticals, oftentimes much more than in other industrialized countries. They pay the social costs of drug abuse and health concerns related to unused medications, and they pay for the environmental cleanup and water treatment that results when these things get into our environment. They've paid 3 times, and they do overwhelmingly support this sort of model. So we certainly commend the county and hope that you will move forward with this ordinance.
Thank you for being here. Christine?
Good afternoon. My name is Christine Flowers, and I'm the program manager for the California Product Stewardship Council. It is a nonprofit which formed in 2006 to educate and support the implementation of extended producer responsibility, and we strongly support this ordinance. Our board is comprised of both public and private sector members working towards a goal. We want businesses to thrive, and they do in this model. We've developed fact sheets specific to EPR for medications and countries in Europe, including France and Portugal, and as near as Mexico, Brazil, Colombia, and some of the provinces of Canada have very successful programs designed and operated by private sector. This ordinance aligns with those models. This policy approach works all over the world for a variety of products like household batteries, automobiles, packaging, pesticides, paint, sharps, and medicines. CPSC has long received strong support from this county, and Rob Darcy was one of our board's founding chair. Pharmaceutical disposal is a growing problem that the public wants solved, and we have very specific data on this for Santa Clara County because we're working with the county and the city of San Jose on a grant for the Santa Clara Valley Water District to expand the medication collection program to add 50 new medication bins, and we're having trouble doing so for several reasons. We have a survey of the public. Nearly 6,000 people responded on what they do with their medications and what they want to do, and many have expressed frustration at the lack of convenience. They've told us what they've done with the meds, and some of them are taking them back to collection events when they're available. They're disposing of them in the trash or flushing them. Some of them are even burying them in their backyards. We're trying to convince the pharmacies to pay the disposal even when we buy the bins for $1,000 doesn't go over well when the drug producers have no cost or share of the responsibility. The county cannot afford the full cost of the program. In short, we support the adoption of the ordinance, which aligns with best practices, and it's funded and operated by medicine producers that we have that are doing this across the world, where industry does what it does best and government provides adequate oversight on the program. Thank you.
Thank you for being here. Back to Supervisor Yeager.
Thank you. First off, I clearly don't own enough stock. In fact, I don't own any stocks, so I've got to go out and change that. Right after this.
It's a little hard to get a quorum here.
Right after this meeting, I'm going to go out and buy IBM or whatever it is. But anyway, really, thank you for all the speakers who've come. Very gratifying to hear from you. We've been working with many of you for really quite a long while. It was actually 2008 when I did my very first referral on this, and so I've been following it and working with many of you, and for all the reasons that you stated that this is needed. It's why I've been working on it so hard, and certainly appreciate all the work that staff has put in with this into this over the years. It was in 2008 that I proposed the original development of a drug take-back program that allowed our household hazardous waste program in the sheriff's office to collect unwanted medications from county residents. It currently collects approximately 35,000 pounds of drugs every year. Although it has been effective, this program has been limited to a dozen locations throughout the county. That is why in 2013 I proposed we expand the program to include pharmacies across the entire county through the concept of extended producer responsibility, requiring pharmaceutical companies to pay the cost of disposing of their unwanted medications, and certainly appreciate all the work by County Council in doing this. The ordinance proposed today will increase the number of locations to at least 50 sites spread evenly throughout the county. I have felt strongly about this issue of safe disposal of medicine for many years for 3 reasons. One, it can improve public health, it can preserve the quality and safety of our region's water, and it can save the county taxpayers money. To safely dispose of these unwanted pharmaceutical drugs that have harm when used in the wrong way or disposed of improperly, it costs the county around $50,000 every year. It shouldn't be the responsibility of county government and our taxpayers to protect ourselves from a product that we do not make or sell. Unused medications often end up being used by those who shouldn't have access to them, such as seniors who sometimes misuse or confuse their medications, children who accidentally gain access, teenagers ingesting medications that they have perhaps stolen from homes, and even pets able to retrieve medications thrown in garbage. Medication that is not properly disposed of can also end up untreated in our water supply. The chemicals from these medications can end up seeping through our landfills or septic tanks and into our groundwater. Untreated by wastewater treatment plants, these chemicals can also flow into our rivers, lakes, or bay, where scientific research indicates that they have the potential to damage aquatic life. In Santa Clara County, we already have a limited drug disposal program that effectively collects approximately 35 pounds of drugs every year. By expanding it further through today's ordinance, we can save the county money while increasing its impact. I'm glad we are going to join a few other jurisdictions in California in pursuing our extended producer responsibility ordinance for unused pharmaceutical drugs, and as we have often seen, other counties throughout the state will follow our lead. As I've often said, by leading here in the county on public health issues, we send a strong message to the state of California and other governments on how to lead on the big issues that we're facing. I didn't know if staff had anything to add. I probably covered most of that, but you're all looking very good there. But Sylvia, if anybody has anything else what you want to add as far as the ordinance is concerned.
Well, let me start by introducing staff. Sylvia Geigus, Deputy County Executive. I have to my right Greta Hansen, who is the lead attorney for the Social Justice and Impact Litigation Team. And to her right is Marlene Dalinger, who is an Impact Litigation Fellow. And then the last person I want to introduce is Rob Darcy, who's our manager for the Recycling and Waste Reduction Division in the Consumer and Environmental Protection Agency. We're very pleased to present this program, and we'd like to just very briefly discuss the main features and benefits. But before we do, we would be remiss if we didn't acknowledge the leadership of this board and other boards in championing initiatives that promote public health and sustainability. And what comes to my mind is the single-use bag ban, the Happy Meals ban, the ban on expanded polystyrene, the lead paint litigation, the restrictions on tobacco access and e-cigarettes. It's very gratifying to work for an activist board, and it's through your leadership that this particular council's office, the Social Justice Impact Litigation Team, was able, on behalf of CSAC and the League of Cities, to take the lead in defending the pharmaceutical industry's suit against the County of Alameda. So we were given that space and the opportunity to take that role. I also wanted to add that it is fitting that this county adopt this program because, as one of the speakers noted, Mr. Darcy, for the last 14 years, has been a statewide leader in the extended producer responsibility movement and, in fact, was a founding member of the California Product Stewardship Council. And so this will make this fellow over here a very happy man. He's been working a very long time, as many of you know, on this.
He has. Thank you, Rob, for all your years on this.
This program builds upon the work of the other counties, Alameda, San Mateo, and San Francisco, and we've incorporated lessons learned. So frankly, we think our program is going to be the best in the area. And to the point you made, indeed, like we've done with single-use bags, by enacting this, it creates this critical mass where the state will, in fact, we hope, be compelled to enact something statewide. So with that somewhat brief introduction, I'd like to introduce staff.
Thank you, Sylvia. Good afternoon, President Cortese and the board. Clearly, you've heard that I've been engaged in this for some time, and I am thrilled that you've championed this ordinance to make it happen in Santa Clara County. Prescription drugs and over-the-counter drugs have come to national attention, much of which you've seen in the headlines of newspapers about water contamination. But they also pose a serious danger to the elderly and children and just those that want to abuse them. As the Center for the Disease Control states, it's a painkiller epidemic. So we need to provide convenient, safe, and legal disposal solutions for Santa Clara County residents. We need to take every action possible to minimize the harm to help residents keep their homes safe. People have an inherent intuition about disposing of these things. They know they shouldn't throw it in the trash. They know they shouldn't flush it down the toilet or down the sink. This is just in them somehow. I see this every day through running the countywide household hazardous waste program. So when they keep these things and don't have a disposal route, they wind up stockpiling and keeping them and they become victims of unintended consequences. So I'm particularly frustrated simply because I've run a household hazardous waste program for every resident in this county, with the exception of the city of Palo Alto residents, and have been unable to take these painkillers. We're prohibited by federal law from accepting these painkillers being controlled substances, by the way. OxyContin, your Vicodins, your Percocets, these kinds of opiates that are particularly dangerous. My office promises to work directly with these manufacturers upon passage of this ordinance to develop systems throughout the county for the appropriate geographic coverage that brings those services needed by all residents of this county. This is not a class problem. This is very much a need for every single resident in the county. As you've heard, these systems have been working in Canada to our north, Mexico to our south, and frankly in most developed countries. So one of the things that has made this a little easier for us, as well as recently, actually October of 2014, the Drug Enforcement Agency promulgated new regulations on how to handle these controlled substances, which again was our primary obstacle. Those regulations have allowed now pharmacies to participate in the collection of it. There are strict requirements associated with that in terms of chain of custody and these types of things that are required, frankly, for hazardous waste. But because of those regulations, we can now reach out to the retail partners that we can create side by side with those pharmaceutical manufacturers that are, as a result of this ordinance, be funding those activities and create a successful and healthy outcome for all. Thank you very much again for considering this.
Let's continue. Proceed.
Good afternoon, Supervisors. Marlene Dalinger with County Council. I'll just say a few words about some of the key points of what the ordinance would require. So first and foremost, the ordinance would require drug companies to take responsibility for developing, operating, and fully funding a convenient program through which residents could dispose of their unwanted medications. This program would only apply to drug companies whose products are sold here in Santa Clara County. And the drug take-back would take place primarily through a system of secure collection bins in retail pharmacies and law enforcement agencies throughout the county. And I should stress that no law enforcement agency or pharmacy would be obligated to serve as a collection site. That would be voluntary. The system would include a minimum of 10 take-back locations in each supervisorial district in the county, and overall approximately 90 take-back locations throughout the county, so it would significantly increase convenience of disposal. And the drop boxes would have to accept both over-the-counter drugs and prescription drugs, including controlled substances. The participating drug companies would have to actively promote the program so that residents would know about it and would know where to find the most convenient disposal locations. They'd also need to report annually on how the program is going, amount of drugs collected, so the county would have an understanding of how effective the program is. And overall, the county principally plays an oversight role here. So the county would be able to approve plans for a collection program before the drug company's collection program goes into place. And the ordinance also gives the county a number of enforcement tools to ensure that drug companies are participating in the program as required. So.
Thank you. Anything else? Greta? Okay.
Make the motion. Tiffany, you need to put it up on the screen. There you go.
We have a motion by Supervisor Yeager, second by Supervisor Chavez. We can now conclude the voting if nobody has anything else to add.
Good job.
So it does carry 3-0, and we have the two supervisors who had to recuse themselves. Thank you for all your hard work.
Thank you, everyone.
We're all aware of
Congratulations.
how long and hard you've been working on all of this.